the resource person also, and also to give you the briefing regarding the session. I think we can wait for another 5 minutes because we have to get most students to join the session. Okay, thank you.
Okay, sir. Okay, thank you so much, sir. Thank you. So shall I introduce, shall I start, or shall I wait for some more seconds? 19 participants are there now.
You can give a brief outline regarding the
okay, sir. Okay.
session, then I can slowly start.
Okay, sir. Yeah. Okay, sir. So, respected Dr. Shalom Yanatanka, Professor and Head of the Department and Convener of this National Workshop on Solid Waste Management, Professor Dr. Sabu Joseph, the Organizing Secretary of this program, Professor Dr. Jayadev, Dean, Faculty of Applied Sciences and Technology, Dr. Shirley Williams, Associate Professor of the Department of Environmental Sciences, Faculty of Department Dr. Bindya and Ms. Navami, faculty from other institutions, distinguished delegates and dear participants. A very warm good afternoon to one and all, and welcome to the second technical session of the second day of the national seminar. So we have had actually very informative as well as interesting sessions till now. And now we are going to have another expert session by Srimati Premalatha. So I am to introduce Srimati Premalatha to you participants. Let me do that. Srimati Premalatha did her BTech in Chemical Engineering from TKM College of Engineering and MTech in Environmental Engineering from CET. She has also done MBA in Operations Management through IGNOU IMG. She has been working in Kerala State Pollution Control Board from 2004. Presently, she is working as Environmental Engineer and Section Head in Kerala State Pollution Control Board. Premalatha ma'am will be talking to us about biomedical and e-waste management and governing rules in India. Before handing over the session to Srimati Premalatha, let me request participants to kindly post your queries as well as comments in the chat box. We'll have a discussion towards the end of the session. So students are especially expected to do that. So we may have to wait for a few minutes. I think now I can hand over the session to Srimati Premalatha, ma'am, and thank you so much. Handing over the session to you, dear ma'am.
Thank you, ma'am. Shall I start or wait for 5 minutes, sir?
Madam, you can give a brief outline regarding what you are going to talk, then slowly start. You can okay. Brief. You can wait for a few more minutes. You can just start and give an overview of what you are going to present for a few minutes. Then you start. Okay.
How many are there in the morning session? 24 50, plus.
55.
More than 50. More than 50.
More than 50.
50. Okay. Then I think we may wait for 5 minutes.
Yeah.
Students will be greatly benefited by this session, ma'am, because they are having some of these rules etc. in their curriculum as well. So I think they can be greatly benefited, and so they can ask queries as well, their questions, their doubts, etc. So students, you are directed to ask doubts regarding the session.
Okay. It is better to ask the questions at the end of the session, I think.
Yeah. So we can arrange it. They can post the questions in the chat box also. At the end of the talk, we can see the chat box questions one paper and you can clear. And also, if anybody want to talk orally, you can ask them to unmute the mic. And okay, the questions can be in English, Malayalam, no problem. Generally, we conduct the program in English. Some of the participants may not be knowing Malayalam, major ideas, but some case studies, if you want, you can give in Malayalam also, because it will be more attractive for the students if you speak in Malayalam.
Okay, I think some of the participants is from outside Kerala. I think.
Kerala. Yeah. So one from MSc Bharathidasan University, one postdoctoral fellow. Then we have Professor Evira Ramaswamy sir. He's from Tamil. He's in MG University. He's the professor and director of MG University. He's also participating in the program.
Oh, in addition to research students and scholars, some professors are also
participating. Okay, one assistant professor from USAT participating. So we have a few teachers from Kerala University also. So it's a mixture. So it will be very useful for them, because theory, some of the theory they are learning, but here we can we will get the rules regarding. For example, the morning session we have solid waste management rules shared by Dr. Sheila. Then she went on to the plastic waste management. So it was very inspiring. And participants asked some questions related to the government, various measures taken by government in certain aspects. For example, plastic waste collection, processing, all these things, etc. Only PCB can answer that questions, because you know very well what is the actions taken by the government in each of the areas, to what extent it will go, all these things, or what are the upcoming events in connection with the particular aspect, all these things you can share. So that type of information will be very useful to teachers also, because when they go to the classes, they can share the information. So
yes, she is also joining at the end of the discussion also.
Okay. In the morning session, what we did was some questions I asked in connection with a particular slide. So we cleared that topic at that time itself. Then all the general questions we actually kept at the end of the session, and at the end of the session, Dr. Sheila actually answered the questions one by one. It was a very informative, very interesting two-way. It's not monologue, it was a dialogue. So participants also actively participated.
Yeah,
I think we can slowly start. We can start, madam. No problem. Okay. You'll be joining. Okay.
Shall we start?
Okay.
Start.
Yeah.
31 were attended. 31.
You can upload your slides also. Just now you try to upload your slide.
Yes.
Okay. Okay, put it in the PPT mode, madam. Put it in the PPT mode, full screen. Is it
okay? Okay. This one. Yes. Yes. Is it in full screen?
No, ma'am.
Yes, now it's okay. Now okay.
No. Okay.
Okay, madam. Thank you. Please proceed.
Okay. Thank you for your kind words, sir. Good morning, all. Respected dignitaries and dear participants, including students, scholars, and other college professors and all. And I am Premalatha. I am environmental engineer, Kerala State Pollution Control Board. And first of all, I express my sincere gratitude to Dr. Babu Joseph sir and the entire team, Department of Science, for inviting me to deliver a presentation on waste management rule. I think in the morning section, my colleague Dr. Sheila, she have given a very elaborate session on solid waste and plastic waste rule. And in my section, I am going to cover biomedical waste and e-waste rule and its management and its governing some act and rules and important provisions like that. Then I think before directly going to the presentation, I think it is better to start with our Mahatma Gandhiji's greatest environmental, globally concepted that word. I think it is better to start with that, because Gandhiji, as all of us know, Gandhiji is the greatest environmentalist in the world. Because Earth, his famous quoting, you can read that, Earth has enough to everybody's need, but not the greed. That's all about environment. Gandhiji never used the word environment protection, but what he said and did makes him an environmentalist. That all of us know. So, he supported. He is not supported mass production, but he supported production by mass through simple living and through high thinking. That is the word, thinking globally and acting locally. Without quoting this sentence or Gandhiji's these words, I think no presentation shall be in its true sense. That is why I quoted this sentences. And it is also because I being a representative of regulatory body, and my audience, you are being the nation builders and the future generation. I think it is important to understand these words. Otherwise, the compromise between regulatory bodies and the future generation, it will not be achieved in a safer manner. Otherwise, we may become environmentalists. I am not degrading environmentalists, but environmentalists in the true sense, we have be. Our younger generation also, being students, you should also be like that. Then the second point I wish to say is that, also, as all of us know, Earth Summit 1992, and in that conference, about 178 countries and some 117 parties, representatives of states were participated. In that conference, the major topic was on the global concern of environment. And that in that conference also, they proclaimed some Agenda 21. I think all of you know that. And in that, they proclaimed 27 principles. Out of that principles, the major and foremost principle we have to keep it in mind that human beings are the center of concern of sustainable development. And they are entitled to lead a healthy and productive life in harmony with the nature. The conference was actually aimed to discuss about the interrelationship between human beings and nature. And the main principle in that is the foremost principle is that human beings are at the center of the sustainable development. In that Agenda 21, some other 27 principles are there, I told earlier. And the second one is that sustainable development is important. You know that what is sustainable development, and to achieve the sustainable development, this environmental protection is to be integrated with the development activities of that country. It is very important. So we have to come together, environment protection as well as GDP, means development activities of that country. And another principle, I am telling only about that in important principles. Another principle is every states means every country, can freely formulate their own environmental policies depending upon their geographical area and their demographic structure there. And that also provided in the states can formulate their own policy. The spelling, some mistake is there, excuse me. Then similarly, according to that principles, 27 principles in that, every country should have to share their technology innovations, technology transfers, partnership deed should be there, free mentality for the transfer of technology, etc. Everything was aimed for the protection of our Mother Earth. You know that we all are under one Earth, the Mother Earth. So this partnership mentality, everything should be there that are included in the principles. And accordingly, after that 1992 Earth Summit at Rio de Janeiro, every country, they formulated their own national environment policies. Similarly, in India is also a national environment policy. 2006 is now prevailing in our country. And you just imagine that, you understand that if this policy, it cannot be formulated by concentrating or biased on in any area. It should be considering the forest policy, the population policy here, what are the agricultural policy, what is here, natural water policy here, everything should be considered. And depending upon the natural resource availability in India, our standard of living, our climate, everything are factors, and depending on all these factors, we should formulate, we formulated the national environmental policy. 2006. Further additions will come to the policy depending on the need basis. And that principle, okay. Then I said earlier that this policy is not taken by concentrating on any area or something like that. After a great discussion for a long time, the central ministers, MPs representing various states, state government representatives, industrial associates, the next point is important, that is academic researches. That is the role of you people, the participants, because you can research, elaborate, you have the freedom to research in and any innovative technologies. You can contribute. You can attend in this formulation of this policy, and civil societies, NGOs, and all public, we can express our concerns while formulating this environmental policy. Then some basic principles, I would like to say that major basic principles of this policy is that conservation of environmental resources. And everybody knows this is of global concern. In this matter, environmental resources should be equitably proportional to the current generation and future generation. So the equitable access for all to the resources. Then for that we have to use the judicial use of resources. That is actually sustainability. Then I told earlier, integrate environmental concern in developmental activities. Then environmental governance, that is transparency and accountability. That is freedom to transfer or trade between countries. We can trade newer innovative technologies. Then enhancement of resources, that is partnership, sharing of skills, knowledge, etc. Then we know that environmental policy is not only for protection of environment, but for the protection of the citizens. Another principle I just omitted that polluter pays principle is also there, precautionary principle is also there. These are important because in these days, our Honorable National Green Tribunal Court is issuing very number of orders regarding this compensation and all. Polluter pays principle is very important. That is, who is the polluter? He should pay. That is polluter pays principle. Precautionary measures is a principle is also there. So if we develop some technology or some activity we are proposing, it will be better for our geographical area, but it will affect the geographical area or the concern of the other states. Such activity, some Basel convention like that, support such activity, we have to follow the principle, precautionary principle. All these are parts of our National Environment Policy 2006. Then I told you, environment policy is not only for the protection of environment, but for the protection of the citizens. So next we are coming to our topic, that is healthcare facilities and all. Healthcare facilities and the waste generation is increasing all over the world, because you know the better health system and it's the right standard of living. If the standard of living increases, the management, waste management practices improve, and health services. Both in that objective, facilities are increasing, and thus waste generation is also increasing. You know that Kerala is among the top among the larger 21 states. Score is about 74. It may be some slight variation may be there, but Kerala is one among the top. Then you just imagine what are the primary objective of our health system. You just imagine health system means it contains from starting from the cleaner staff to the doctors, nurses, paramedical staffs, and everything to the administrative staff at the top. These everybody is from the chain. They are the coordination activity only should be properly implemented. Otherwise, the proper biomedical management should not be proper. So, primary objective, as all of us know, is life saving and curing of diseases and control of diseases. It should be like that. Otherwise, our human beings will suffer. So, while discharging this primary responsibility of these workers, healthcare staffs, some lapses are or some they are concentrating on the first part. Then some defects were occur in the other utilities areas. And waste management, I think it is one such area, waste management. Then that is because most of the cases it is because of lack of awareness. In some cases, if one person is appointed in one section and within 1 month or 2 months he is then shifted to another section, then this training and awareness is very important, because it is unlike other solid waste. It is highly infectious. Even though the small percentage only is infectious, it will contaminate the entire waste. So ultimate utmost care should be taken. So intermittent, in addition to induction training, routine and intermittent trainings are needed. Then in the next slide, I am going to see some annual reports, that is status of healthcare facilities in our country. And you know that biomedical waste rule, as per the prescribed authority for the implementation of biomedical waste rule, is at the central level it is Central Pollution Control Board, and state level it is State Pollution Control Board. And we can depend only upon the annual report of the Central Pollution Control Board. I can only say about that only. And other studies and numbers are there, but annual report, at every annual report is the total numbers and the status starting from January to December. And the healthcare facilities are submitting this report to the Pollution Control Board, and we will combine it and we will submit to the CPCB before the next July. Then this annual report, I am just showing 2018, because 2019 report is under preparation by CPCB after collecting from all states. Kerala already submitted 2019 report in 2020 June or July. They are just compiling it. That is why I am not showing that slide. But this is just regarding the 2018 annual report. Now number of healthcare facilities are this much. I think it is now 2.2 lakhs above. Then number of beds is like, this is only for some information. Then the comparison with the annual report 2000, the rule, as all of us know, is came into effect in 2016. And while comparing the annual report that 2016 and 2017, then it is why I am showing this slide is that still in that period the number of healthcare facilities not increased, but the number of the quantity increased. Decrease of healthcare facilities, but the quantity generated increases during that period. That is why, because CPCB commented that the proper segregation storage was not there. But now the status is issue of this notification of this 2016 rule. Then 2017, these are some lapses from while comparing with the CPCB annual reports. That is annual report. If for proper quantification of anything, we need the actual values of submission, that is accountability we have to get. So now, a non-submission of annual report by all healthcare facilities was the one of the drawback. And some of these states, they have not developed common biomedical treatment facilities in respective states. In Kerala, we have common facility, and some mercury waste disposal. Some states are not properly managing it because of they don't have the common hazardous waste disposal facility. Kerala, we lucky to see that we are having a common treatment and hazardous waste disposal facility also. Some states, these common facilities where they were not installed this emission monitoring system continuous. This is because this is for ensuring our emission quality standards we have to achieve it. Otherwise, due to the operation of this common facility, our air pollution or water pollution like that may occur. So then another lacking, they noticed that biomedical waste management in veterinary hospitals. See, in 2016 rule, actually, Ayush hospitals, including Ayush clinics, were also included. Then the donation camps, blood donation camps, health camps, everything is included in this rule. This is the annual report 2019. That is Kerala, we have submitted the annual report. Now about 13,869. This is also not final because we identified this much number of hospitals, and again we have to bring all other hospitals like Ayush, veterinary, etc. should also come under our purview. And now the inventarization is progressing. It reached about 15,000 and all. And see the next point, that is number of birds per 1,000 population. See Kerala in this figure, you can see that 3.3. That is 10,000 population, about 33 beds are here. This shows the better position of the state compared to other states. We can see that in other West Bengal and some other states, it is about 0.2, then 1, 2, something like that. Then better hospitals also 2126. It may be some slide here, or everyone is not submitting, and some fluctuation may be there. Total number of beds. This is 1 lakh. 1 lakh plus is there. Total number of beds. If we calculated per 1,000, it will come about 29, 3.3. Means about 10,000, 33 or 29 to 33. Number of non-bedded clinics are high. Veterinary institution also, it will increase this number that I noticed at the bottom, that is inventory progressing. Then the other things I have to explain is that what are the distinct properties of biomedical waste. Unlike other solid waste, biomedical waste has some peculiar characters. That if it is stored beyond a certain period, it will transform into other forms and it will contaminate the entire waste, or it may lead to some health hazards in the environment. So it should be handled in sound environmental manner. Then non-biomedical waste is also there. So we can see that out of this hospital waste, only 10 to 15% only infectious waste. Other waste may be non-infectious. If it is not properly stored, segregated, it will contaminate the entire waste. And some sewage and sewage, you know, that is liquid waste generating from this one. In addition to this, biomedical liquid waste is also there. That is from the laboratory and all. It is in should be managed in another scientific way itself. Then emission from generators, incinerator, then noise. I think these are the waste streams from a healthcare unit. I think quantity of waste generation, that is solid waste, this figure may vary depending upon the countries, that is developing, developed or underdeveloped country. This solid waste generation will increase 1.5 to 2 or 4 kg per bed per day, something like that. Then liquid waste, this is one standard liquid waste, 45 or 50 liter per bed per day. In solid waste classification, hospital waste that I said earlier, general waste is non-hazardous 85%, infectious 10%, toxic 5%, biomedical waste is there. Then properties of biomedical waste. That is, if we when we are concerning about the biomedical waste management, first and foremost thing is the hygiene and sanitation. It will depend upon the type of healthcare and the management practices there. The ultimate aim is hygienic and sanitization, and a very good healthy environment should be there at the hospital. Then waste minimizing, that I said earlier, that if the waste minimization is not there, that means it is not properly stored or segregated, then the quantity of waste will be alarmingly increased. Then it will result in the transportation cost, every cost it will result, and ultimately it will come to the burden of the common or the captive treatment facility. So scientific storage, segregation at source, waste segregation is important. I said earlier that waste management section, cleaner staff, from cleaner staff to other paramedical staff, everybody is coming under this rule. Then they may be, sometimes the cleaners may be not educated well much to identify whether it is biodegradable or non-biodegradable, or infectious or non-infectious. Is it hazardous? They don't know. But in that situation, we have to some color-coded containers. Then some pictorial representation if you paste there, and we can educate them that this should be come to this and this. You should not mingle these two containers or something like that. Then once I said the generation of biomedical waste, we could not avoid it at any stage, because the health of the human beings, their life saving is important item. Then once the waste is generated, then first thing we have to make arrangements to minimize that. Some methodology or some techniques we have to use, and we have to minimize. Okay, then we generated, we will store it, and as per the rule, some prescribed time limit is there. Beyond that, if we keep for beyond that period, it may transform to some other form. And as per the rule, biomedical waste rule, 24 hours in summer season and 48 hours in winter season, because of the temperature. If the temperature will affect the nature or transformation of this waste, then the waste is generated. Then the next thing we have to think is whether the waste generated is to be treated at the hospital itself, or it may be treated into other places. Then we have to go for, first we will think for a captive treatment facility, that is these treatment facilities at the hospital itself. Then you just imagine this, if we have to implement a captive treatment facility at the hospital premises itself, it will be a very high capital cost, very high operating cost and all, and this total cost will in turn will come upon the burden of the public itself. And that is one point. And the second point is that if it is treated in the captive at the hospital premises itself, it may affect the patient's health also. So then we may think for the second thing, that is we have to treat it some other suitable places. Then there comes the concept of common treatment facility. So then it is okay, we identified some suitable places for the common treatment facility. Then we have to transport this waste from this source generation to that treatment facility. Then transportation time is there. Time limit should be there. Within that time frame, we have to dispose it. So that thing, if highly infectious and microbiological waste is there, then within that transportation period, it will be harmful to the surrounding or environment. So pre-treatment, there comes the necessity of pre-treatment of highly infectious and microbiological waste at the source itself. Pre-treatment should be done, and then only it is transported to the common facility. During transportation, waste transportation is point, we have to keep in separate dedicated vehicles with that label. Separate label is there. That label should not be used in any other vehicles, though so dedicated vehicle, dedicated trained manpower should be there. The secondary distribution or pilferage or something like that should not happen. It may happen because that this biomedical waste contains some valuable recyclable materials also. Then there is chance that scrap dealers and something persons, they may think that once this the nurses or paramedical staff, they think, oh, the waste is stored in the storage area, then from there is chance to secondary segregation for some income and something like that. It should not happen. So barcode system should be implemented. That is also included in the biomedical waste rule. Barcode system throughout the transportation, source of generation to the treatment point, it should be monitored. Then okay, it's waste generated and it is transported to the transportation common facility. Then waste treatment offsite, that is common facility. Then there the final disposal. After completely recovering the recyclable materials such as plastic, glass, and some other metal parts like that. That category I will show you in the coming slides. So these are to be recovered. This recovery is important because of that the load of the common facility for the yellow waste or incineration should be minimized. Otherwise, our air emission, everything that we have to keep it in mind. So final disposal only unrecovered and only incineration. In our state, there is no deburial and all. If incineration and deburial is also allowed in the schedule. So, then the point, maintenance of records. When if the quantity of biomedical waste generated should be properly recorded and it should be reported to the authorities also. So that comes the requirement of annual reports. Then accident report, it is also important. This simple needle prick and that all will not come under accident reporting, but some testing of vehicles or some water contamination chances or like that, it will come accident report. Accident, it will come under a separate form is there, and this have to be reported for taking corrective measures. For immediate corrective measures, they should report, and the measures should be there. Then training and safety is very important. I told earlier that in addition to the induction training, intermittent training should be there. This common facility, they have also the responsibility to give this training to this healthcare facilities. Hospital itself is having the responsibility to conduct trainings. They have to, if the number of beds are very high, they have to form a committee and they have to meet in weekly or monthly and to monitor the management practices there. That is monitoring evaluation. Then monitoring evaluation by the authorities also. You know that pollution control body is the prescribed authority for the implementation and monitoring of this one. Then their instances are there that I told. So biomedical waste are not properly handled. See, some NABH lab accreditation, some studies regarding that. The report that about 20 to 25% of the doctors and 80% of the paramedical staff, they are not aware of the pollution control, so waste management practices. They are not aware. It is very dangerous. So pollutants are invisible. We know that pollutants are invisible. So prime duties are overburdened, then lack of awareness, lack of training, then dedicated manpower for waste management. This one is in every hospital, this lack of manpower, their training. This is the major problem we are facing then. Then the next is what is the biomedical waste that already I explained. That is waste generated during the diagnosis, treatment or immunization of human beings or animals. All healthcare facilities including veterinary, Ayush hospitals are also come under the purview of biomedical waste. Then research activities are also generating, and you researchers can know that, you may be aware. Research activities, some rats and some animals, something like that. Their life-saving, some probably this death animals, it should be properly, this comes under anatomical waste itself. So it should be properly incinerated or through their own incinerator or captive facility. Then by the health camps and including categorization. Then what are the waste generated during that category is there? Human anatomical waste, animal anatomical waste, soiled waste. All these are self-explanatory. Expired or discarded medicines also there. These medicines, it can be returned to the manufacturer itself, or they have the provision there for the manufacturers. There the incinerator may be there. Then they can incinerate there, or we can hand over to the common facility. They will collect it and they can incinerate their own incinerator, or they can hand over to the manufacturers itself, medicine. Then chemical waste is also like that. Chemical liquid waste, it should be disposed after proper disinfection to the ETP or the whatever may be the effluent treatment system they have provided. Then discarded linen, mattress, beddings, etc. also come under this yellow category. Microbiology, biotechnology, other clinical laboratory waste, contaminated recyclable waste. IV with then plastic materials are there. All these plastic materials are virgin plastics. So we can reprocess it safely. Then waste sharps including metals, we can after disinfection and cutting, we can store it and send for the industry concerning iron industries or steel industry, something like that. We can tender it and give. Glassware also like that. Metallic body implants. Then here comes biomedical waste rules. And in the first rule came into effect in 1998. And biomedical waste rule, after that the new superseding this 98 rule, biomedical waste management rule 2016 came into effect. Then 2 amendments were added. So amendment is the aim that some corrections were there in the 2016, some non-chlorinated plastics like that, ban of non-chlorinated plastics. Then it is amended in ban of chlorinated plastics, except in blood bag, urine bag, etc. can be chlorinated plastic. Till other alternative measures is not get, till then this chlorinated plastic can be used in that. Then 2019 also some amendments regarding ETP and something like that, greater than 10 beds should also provide STP. Then by mistakenly, I think in the biomedical waste rule 2016, they amended accordingly in the coming 2 amendments. Then who are the applicable? All persons generate. Then means some health camps or something like that. The coordinators who are the nodal officer for organizing this, they are also responsible for the safe management and disposal of this. For that, they can contact their local bodies or urban local body or panchayats, and they can give agreement with the common facility, and they can, or need basis, they can directly contact our common facility, this veterinary hospital. Then generations, collection, use, storage, loading, transportation, unloading, processing, all persons come under the purview of this rule. Then it does not applicable to radioactive waste, hazardous chemicals, solid waste covered. It does not mean that it can be handled in any way, but no, not like that. Separate rules are there for handling this radioactive waste, hazardous chemicals, electronic waste and all. Then this occupier means, if I told earlier in the principle or agenda 21 principle that polluter pays principle, then if a default is committed, then who is responsible? Then the occupier is the responsible for that fault. So occupier means a person having the administrative control over the institution and premises generating biomedical waste. Not the cleaner staff or the nurses or something like that. Occupier means a person having administrative control over the institution. And this is one pictorial representation. You can see that yellow bag. Yellow bag is the most infectious waste will everything may be, infection may be there, but mostly anatomical waste, chemical waste, and all these waste, including discarded linen and medicines are laboratory waste, come in the yellow bag. See, all these bags should be labeled this one, biohazard. This symbol could not be used in any other else. Then in the red bag, contaminated plastic waste. Then glass waste and metallic implants comes in the blue container, and metal shafts, it should be in the white translucent transparent containers. And this is hazardous and other, this is for domestic hazardous waste. Some biomedical waste will also come under domestic, that is in the form of medicines or tablets, something like that. These comes under the hazardous and other waste. You can store it in the black container. Recyclable general waste in the household can be in this color, and biodegradable in green color. This should be handled by the local bodies. Local bodies, they should provide, I think in the previous presentation, Sheila ma'am will explain that. Explain in that methods. Then these are all. Then you can see that human anatomical waste and animal anatomical waste, the mode of disposal, we can be incineration or plasma or deep burial. The first preference note, the most practically now applying is incineration. Incineration, nothing but it is incinerated at high temperature, and it will be completely, it will destroy the pathogenicity, and only carbon dioxide, water in the emission, and some ash will remain in the bottom. In plasma burial pyrolysis system, it is also something like incineration process, but for incineration we have to it is some exothermic reaction, but plasma pyrolysis is endothermic reaction. So high voltage and UV appliances should be there, so that it will convert into 3 modes, that is syngas like carbon dioxide, water. We can get the fuel value from that, and some liquid form fuel oil is getting, then the bottom we get the coke, char, etc. So these two can be the can be a mode of, but I think for this incineration, the temperature only up to 1050 plus or minus something like, and plasma pyrolysis we can go up to 5000 degrees centigrade, and above that we can go. So complete sterilization means pathogen elimination is possible in plasma pyrolysis and all. In our Kerala, no plasma pyrolysis, only incineration in our common facility. And if these two cannot be done, only deep burial, and if two in the urban area, it cannot go for deep burial. Some specific standards should be there. Then the other soiled waste incineration, plasma pyrolysis. In the absence of the above facility, we can go for autoclave or microwaving or hydrowaving, followed by shredding or mutilation. This is shredding and mutilation is important. Otherwise, the sterilized products can be utilized by some other informal or unauthorized scrap dealers or something like that. So shredding, then it is sent for energy recovery. Ultimate option, waste to energy plants, we can go for that. Then expired cytotoxic drugs and items that are to common facility, or now some agencies are working that in medical store itself they are collecting this expired medicine and all, and they will transform it to the manufacturer itself. So they can dispose there. It is extended producer responsibility is also vested on them. Then pre-treat, this is important. Pre-treat to sterilize with non-chlorinated chemicals on site as per national age control. This is because I told earlier that during transportation, it should not be contaminated, or it will multiply. The microbiological waste is there, no? Multiply and viral and some other forms will enter into our food chain, something like that. So it should not happen. So pre-treatment is important, but this pre-treatment is strictly imposed in 2016, and some of the hospitals, majority of hospitals, I think they don't have some this pre-treatment facility, but now it's okay. It's after 2016, it is 20. Now almost all hospitals have provided pre-treatment. Then autoclaving, this is contaminated recyclable materials like tubing bottles, intravenous tubes and sets, catheter, urine bags, syringes, etc. You can give to authorized recyclers or for energy recovery, or to other institutions where it is converted into fuel oil, or plastic can go for road making, like that. Plastic waste never should not be sent to landfill sites. And this is white metal sharp and all. It is stored in the translucent containers, tamper-proof, leak-proof containers. This is all I explained. And this is the label for biomedical waste containers or bags, biohazard and cytotoxic hazard symbol. Can you hear me? Hello?
Yes, ma'am. Yes, ma'am. Yes, ma'am. You are audible.
I no response from anybody. That is why I am afraid whether it is audible or not audible. Okay.
No, you are audible.
Then this is label, no? This is one example for yellow colored non-chlorinated plastic bags and bins. See, these bags, hospitals can provide their own, or the image they are providing this. And recent plastic ban in the state, in the first stage, they banned compostable. They restrict on only compostable plastic should be used in every field. But this biomedical waste, it is not good to store the biomedical waste in this compostable plastic. Then they exempted from the state government ban. This is yellow color. This is the model one. Then category red colored non-chlorinated plastic bags or containers. This is like this. Then white translucent tamper-proof, leak-proof containers. In this, sharps can be better to be transparent bottles. Then next comes the barcode system. It is important because I said earlier that there is chance of taking the valuable product from any waste. There is the chance is there. So in the case of biomedical waste, it is very risky if such things are happening. So in order to monitor that, in the rule itself, the provision is there that barcode system should be provided before 27/3/2019. Almost the image they implemented that all hospitals have provided this QR code containing QR code is given to the hospitals. At the collection point itself, they will scan that one and will send to the server and the common facility, and GPS mode is also there. Then we can ensure that the quantity we collected from the source itself, all the quantity is reached at the facility itself, so that no pilferation or something like that will not occur. Then this in here stakeholders, KSPCB, Armed Forces Medical Service also are represented, because in the case of medical services in defense sector, they have the freedom, they have to implement that. CPCB, the authorization, everything, CPCB will inspect and only on their request. So they have the direct responsibility with Armed Forces Medical Service, depending upon their secrecy and like that. Healthcare facility, then operator of common facility, then the common facility, they does not stipulate any responsibility to the barcode vendor, but they will provide. Otherwise, it is the responsibility of the healthcare facilities itself, QR label. And this is just one chart, that is if the hospital is having greater than 30 beds and above, greater than 30 beds, then the hospital should have provided the scanning system and all. If it is less than 30, some clinics and something like that, then the image will provide the weighing machine and scanner and something. They shall facilitate that. Otherwise, higher bedded hospitals, they should provide it. In compromise, they can adjust or like that. Color mark, or then some yellow color code is there. It's all about having 30, I explained. This is that scan barcode on the central server. Then the wait time, GPS, etc. gets captured automatically, and we can verify that. Central server, it is connected to the common facility and our pollution control board and dedicated barcode system. It's only pictorial representation. Server, everyone can enter. And then incineration, I said earlier, volume reduction and total destruction of microorganisms. Inert minerals, residue and gases are the only products. Carbon dioxide, water, it is come to the air emission, and only inert materials in the ash. This ash is, now at present it is considered in the hazardous waste itself. So the common facility should collect this, and along with their effluent treatment plant, sludge, and some discard medicine, something like that, they have to collect it and send to the hazardous waste treatment facility at Ernakulam, KEIL. In autoclave, then low heat and direct heating with the steam autoclave, just on pictorial representation. Then standard for waste autoclaving. Autoclaving should be dedicated for the purpose of disinfecting and treating biomedical waste. This standards of checking or monitoring these equipments are important. Once we subject to this treating directment, we will not consider as properly treated unless pore test and some tests are there. You have to confirm that. Otherwise, this calibration, this pore test. Otherwise, this microbes complete pathogenicity will not listed. Indicate the required time, temperature, and pressure were reached during or it should be ensured. Microwaving shall not be used. Cytotoxic, hazardous, or radioactive waste, it should not be subject to microwave. This is one just for shredding, some figure only. The needle destruction, it's all of you. It's only taken from Google, something like that. Chemical treatment using at least 1% hypochlorite. This is notified in the rule itself, that at least 1% hypochlorite solution or any other equivalent chemical reagent. It must be ensured that ensure disinfection. For this also test is there. Then disposal by deep burial is permitted only in rural or remote areas where there is no access to common biomedical waste treatment facility. It is actually the deep burial is not appreciable. Then hypo solution X-ray film shall be utilized. These should be handled with hazardous waste management rule. It should be collected and should dispose through hazardous waste disposal facility. Mercury bearing waste, if some spillage of mercury, something like that, you have to absorb it and put it in bottles, and likewise to send it to common hazardous waste treatment facility. Then in Kerala, the status, if we have taken in all over India, there are about 200 plus common facilities that are there. 98, something like 98 numbers are under construction. Already operational, about 200 facilities are there. In larger states like Maharashtra, Andhra Pradesh, Uttar Pradesh, Gujarat, etc., they have 20, 21, above 20 numbers and below 25, like that, common facilities. But we are lucky that in Kerala also we have one common facility, and their services, particularly in this COVID situation, it is appreciable that our common facility is covered all the waste on by operating the facility throughout the house. An image has incinerators. 5 incinerators are there, rotary incinerators there with APCD, means air pollution control devices. 30-meter chimney is there. 2 seconds residence time is for the secondary chamber. Then the required temperature 1050 plus or minus 50 degrees centigrade is achieving. Then scrubber is there. Then all control is on continuous emission monitoring mechanism is also provided at the incinerators. Then autoclave, 5 autoclave is there, microwave is there, shredder, then encapsulation pit. Then now 1 or 2 pits they've closed, and active encapsulation pit is there for storing for the disinfected, sterilized metal parts and like that. Once this is it is much quantity, then they will tender it to authorized recyclers for iron industry and something like that. Then barcode system with the GPS they already implemented in all states in India. Almost majority implemented, but still states are there. They not implemented this barcode system with GPS. This is the image of Palakkad, this industry. The view, front view is here, then rotary incinerator. Then this is the effluent treatment plant. This effluent treatment plant means their effluent is for the washing of all vehicles and all that. This is carefully handled and it is treated. Primary, secondary, tertiary treatment is there. After pressure sand, disinfection and activated treatment, this water is used for gardening and all. All primary treatment system Bakka is provided at the image. This is autoclave. One image is there. No? Then common biomedical waste. This is status I told earlier. Total about 200 plus common facilities are there. In Maharashtra about 31, Karnataka 26, Gujarat 20. In Kerala 1 operational at Palakkad and 1 under construction stage by KEIL. The common attached in the same premises of hazardous waste common treatment facility, and another proposal by image is also under consideration. They have allotted land and some other ownership, something like is going on there. Then the next slide shows the duties of occupiers. That everything I explained earlier, but some points, important points will I just show you and skip off these slides. Safe, ventilated and secured location for storage of segregated biomedical waste in color coded by unless the temperature is a factor. It should be in a proper place so that the sunlight should not be more there. Otherwise, it will transform. Then pre-treatment facility should be there. Then direct transfer, easy access should be there for the common facility vehicle to reach there. Then use of chlorinated plastic gloves and blood bags within this one correction is there. Blood bags is exempted. Phase out use of chlorinated plastic. Not to give treated in municipal solid. Never treated biomedical should not be sent along with this municipal solid waste. Then training, immunization, then barcode system that I explained, duties, annual report. This is important, annual reports in its own website, and all healthcare facilities should within 2 years. But in all healthcare facilities, they are not uploading their daily data, but instead, but some proper documentation is there in pollution control mode as well as the common facility. So somewhat this is important, because no occupier shall establish on-site treatment and disposal facility if a service of common biomedical treatment facility is available at a distance of 75 kilometers. Why? Because if the common facility is within 75 kilometers, then we have to transport to the common facility itself. Otherwise, the time of travel it should be great. So we indirect meaning within each 75 kilometer there should be common facilities. But the major problem we are all facing is that land availability is because of strong protest from the public. So we have to get more facility land allotment out. If such facility is not accessible, at the last preference we can go for landfill prior to. Then possibility of major accident, either toppling of truck carrying biomedical waste or some release of biomedical waste in any water body, but it excludes simple needle prick injuries, mercury skills, etc. Then operator is also having their own responsibility, timely collection if within 24 hours or within all days, if they not collected, then it should be reported to the authorities. Then any accident during transportation, they should report. And these are all I explained to achieve. Okay, this is important because in the 2016 the standard for the residence time in the incinerator, CPCB restriction, 2 seconds time should be there. So all the incinerator in common facility, they modernized, upgraded for achieving these standards. And dioxin furans within 2 years from date of this notification. See, dioxin furans are emitted when chlorinated plastics are ignited or incinerated at about 200, 300, 500 degrees centigrade. So what is doing in the incineration to avoid this is that we will directly put the chlorinated plastic bags at achieving the required temperature in the primary temperature chamber itself. Direct at the required temperature only, the transfer of biomedical waste is practiced. Otherwise, if the temperature is below at around 200, 300 or something like that, there is chance of evolution of this furans and dioxins. Then, without explaining this COVID pandemic situation, how we the Kerala managed the waste, it will not be a true sense. It will not. This presentation will not be good. So I included some, especially regarding this COVID hospitals, isolation wards, how the managed the biomedical waste during this pandemic situation. See, the Pollution Control Board issued, in addition to the Biomedical Waste Rule 2060, they, considering the WHO, ICMR guidelines and all, they notified a separate guideline for this during this outbreak in March, April, and 3 revision also there. They are also issued. And according to that, these COVID hospitals, in the initial period, there only was isolation wards only, then isolation wards, complete COVID hospitals, and later we started first line treatment centers, COVID first line treatment centers. All these COVID waste generating centers, including quarantine camps, home cares, testing laboratory, sample collection center, everybody should follow the guideline of CPCB. Separately, the responsibility is distributed in that guideline. In urban local body, pollution control body is also having the responsibility exclusively. They are explained in that. For see, in the earlier stages in March 2020, something like that, in COVID waste, biomedical waste only comes around 1 to 2 tons per day and all. But later it is increased, and now it reached about 20 tons of COVID biomedical waste. And as the quantity of this COVID biomedical waste increased, this quantity is also increased because of the improper storage and segregation. Improper segregation means all the waste, including this food waste and other PP kits, everything is stored in the yellow color bag, and they just directly handed over to the common facility. Then the common facility, they could not hesitate to take that one. They took all the waste in the yellow bag and they incinerated. But this quantity, when it increases, the incinerator will choke, and at that time it is the problem issue faced by in all states. So it is supervised by some high level committees there, CPCB, Ministry of Urban Affairs, and Ministry of Health central level. They form a committee and they monitored and they took strict action to segregate the solid waste. The food waste and other general solid waste should be strictly, it should be segregated, disinfected and stored separately. And the solid, as per solid waste rule, degradable waste should be disposed like that, and general recyclable material should be disinfected and stored for in their MRF or RRF facility. And then some biomedical hazard domestic waste, it should be stored and then handed over to this after proper disinfection. So in the later stages, again, it is somewhat managed by the image facility itself. Their capacity was at 39 tons per day processing capacity, but it is now increased to, they are permitted to utilize their full capacity, so that 55 tons about this daily quantity will include both non-biomedical and biomedical waste. So they have to manage both. Anyhow, their service, due to their service, we managed so far. And if again the quantities increase, the state may affect, like other states also following this time. All over the world, they are facing this problem. This is one challenge. They have to manage all this COVID waste. Then in order to track the COVID waste, that is whether it is collected and within 24 hours is or 48 hours is it disposed. So one app is developed by Central Pollution Control Board, COVID-19 BWM app. In that, once the generators, first they should register in that app only, image will take the waste. That app, in addition to the barcode system, it is not applicable in this case because biomedical waste and non-COVID and COVID are separately storing and transporting, treating, everything is separate. So dedicated label like COVID waste, dedicated trolleys should be there, dedicated bags, double layer bags, yellow bags, using 2 bags to avoid leakage if any. Labeled containers and keep separately. Temporary storage area should be there for these COVID hospitals and CFLTs. And this must, it should be stored there, and from there they can directly shift it to common biomedical waste treatment. General waste to be collected separately at sourcing. But some lapses are also there. Then wrappers of medicine, syringes, fruit peel off, empty juice, etc. Leftover foods, these are general waste, comes under this. And if it is come in contact with the confirmed patients, we should properly disinfect the products. Then these things, then only handed over. To minimize waste, non-disposable item must be used for serving non-disposable items. That is using biodegradable plates, some leaf and all, something like that we can use for serving wet and dry food. Then if the patients are unable to use the toilets and etc. in collected diapers, it must be treated as biomedical waste and it should be placed in the yellow bag container and handed over to the PPE kits such as goggles, face, everything will come under biomedical waste. So in the earlier slide, I told that about 1 to 2.5 kg per bed per day, but this during this pandemic it may rise to 8 kg per bed per day. Overall, if we are considering this waste is increased due to this PPE kits and all. This nitrile gloves is also dangerous for the common facility because this is not natural rubber, this is synthetic one. So some choking problem was noticed and the common facility is addressing that. Then used mask, head cover, etc. In the COVID, this guideline, these gloves and masks, if it keep for 72 hours means 3 days, then I think let me know the time for this first presentation, please. Hello, ma'am. Everybody is sleeping, I think.
No, madam. I'll just.
Yes.
The valedictory. Let me just check and I'll tell you, ma'am.
Okay. Then I will continue.
Yes, ma'am. Yes.
Okay. I think the presentation total time is sending out 4 o'clock. Hello?
Yes, the end time is 4 o'clock.
Okay, then
yes,
I will.
Yeah, you can continue, ma'am. Yeah.
Okay, this is only biomedical waste. I have to cover the e-waste also some points. So, okay, anyway, I will first. And some next slide, some pictorial representations are there. No, storage and handling COVID-19 waste. It can be used for some visible places so that we can paste it there and use. This I think 3:30, no? 3:20, half an hour only.
It's 3:17, ma'am. Yeah.
Okay. And this is one COVID biomedical waste generated in tons per month. For the records, we got it from the app. That is, once the quantity is entered in the app by the generator and it is entered into the server, we can see that we can monitor it. And in the biomedical waste treatment facility, there also the handlers also entering the waste data quantity. And at the end of the day, we can monitor that whether the generated quantity, entire quantity is disposed. And so we can daily monitor this waste generation quantity is on 29/11/20. That is, in that data, hospitals are about 154, then testing centers about 48, then quarantine centers 43, COVID waste about 19 tons per day. Then non-COVID waste, in addition to COVID waste, non-COVID waste is also generated, that is 41 tons. Then this is important because penalty for contravention, I told you that the occupier is the punishable person for the lapses in their part with imprisonment. This is under Water Act and Air Act. In addition to these penalties, some CPCB guideline is also there that environmental compensation charges is levying from the defaulters or failures on against the healthcare facilities and common biomedical waste facilities as per an order in the Honorable NGT order in OA number 7K. And here we will calculate the environmental compensation, how much is to be levied from the generators, depending upon the type of healthcare, then the size of the healthcare, then the number of days the violation continued. After identifying the date of, then some score is there. We will calculate using this. If it is no arrangement for disposal of facility is not there, then it is the highest score. It is 30. Then if they applied, will the risk is less, that is 10, and improper segregation it would be 20, and like that. In this way they will calculate, and these compensation, there is no relaxation for this. And in addition to the Water Act in penalty punishment, this is the major hurdle for the healthcare facilities. And thank you. I completed the biomedical waste presentation. Hello?
Yes, ma'am.
Any questions from?
Okay. Yes, ma'am. Yes, there are a couple of questions. One is from Mirsana. Her question is like this: during the pandemic, a large amount of biomedical waste is being generated. How can all these waste be transferred to the common center? I think you touched upon that.
Yes. See, I told earlier that in the early pandemic period, in the March, the COVID waste was very less, about 1 to 2 tons, in addition to the other non-COVID waste. But that time, the non-COVID waste was very somewhat about 40% less than normal case, because then all the hospitals, the normal patients were less that time. But now the situation is not like that. COVID patient and non-COVID patients are there in all our hospitals. And this COVID waste, biomedical waste, extra vehicle, extra skilled laborers, drivers, handlers, etc., everything was separate. Dedicated trolleys, everything separate, and it is separately transported to the common facility. And in the slide itself, you can see that in the there the 2 trolleys, they will directly given to the incineration, and this is how they are managing incineration. You can see here, for incineration, yellow bag is in the opposite side for treatment, common facility, red bag is going. So no contact between COVID and non-COVID waste. So the initial stages, the common facility, we have consented only for 39-40 tons per day treatment, but they already have the installed capacity, full capacity was there. We allowed to permitted to work for the 24 hours and they managed it.
Thank you, ma'am. The next question is from Professor Dr. Ramasamy. The question is like this. As mentioned by you, only one common facility exists in Kerala for the biomedical waste by image. What is the method followed at image for the disposal of the residual ash?
Residual ash. This residual ash is generated from the incinerators. 5 incinerators are there, no? In the ash, the contents will be inert and some heavy materials will be there. They will collect it and hand over to the common hazardous waste treatment facility. There the facility is there to dispose and handle this hazardous waste material. So along with the ETP sludge and this one, they transporting to the hazardous facility. And now they are the ETP sludge, that is sludge. Okay, this inert is also going. If it is proved that it is non-hazardous, they can dispose in their own way. But it is, unless it is not proved that it is non-hazardous, it should be go to the hazardous waste treatment facility at Ernakulam, run by KEAL, Kerala Infrastructure Limited. Yes.
Okay, ma'am. One more question from Professor. What is your advice to common man for the safe disposal of disposable masks?
Disposable mask, it is in 2 ways. The guidelines, CPCB guidelines say that if the confirmed patients, if the mask is using, you can just you can dispose along with the biomedical COVID biomedical waste yellow bag, double layered bag, and they can dispose through the common facility itself. If suspected patients and some mask and all things are there in randomly thrown away by some persons, then in household also, if we are quarantined for 1 week, and what will we do? We have to just keep it in paper bag with lid and keep it there for 3 days, 72 hours. 72 hours. After that, you have to disinfect it, then cut it and you keep it there. If your local body is having the facility to take away this to the resource, their facility something, you can send there. Otherwise, you can hand it over to them. They will give to the common facility directly. Before handing over the facility, you should keep it for 3 days in paper bags. Otherwise, confirmed patients, you will not store it. You can hand over to the common facility along with the yellow bag.
Okay, ma'am. Thank you. One more question. I think this should be the last question because we have one more topic also to be discussed. It is from Manikandan. The question is: in Kerala, the medical college and hospitals are huge in number. But why the number of biomedical waste collection centers and processing units are limited?
See, as per rule, I told earlier that the biomedical waste should not be transported to far away places, because within the 48 hours or 24 hours during winter and summer, it should be disposed. But in the rule emphasizes that within 75 kilometers, if each of biomedical waste treatment facilities, if it is there, it is well and good. But the problem faced by all states, especially in Kerala, densely populated Kerala, land allotment, we are not getting suitable land. We are not getting, the public protest is very high. Then we have to take them into consideration about some model plans. We have to show them and showcase, and they to confident. Public confidence should be there. Otherwise, the land. Some public hearing were also conducted by Image in Peringamala and all, but due to public protest, they could not continue that project. They dropped that one. And again, in Ernakulam, they are proposing public hearing is a mandatory. requirement under EIA notification. That is the major problem. So in the industrial area, it is well and good. We can go for treatment plants without public hearing, but lack of adequate land is the major problem.
Okay,
Yes.
ma'am. Thank you, ma'am. Thank you. Now I think you can go to the next topic.
Okay. Okay. E-waste management. I have to end up 4 o'clock. No.
Yes, ma'am. That is the time limit.
Okay. Okay. I will fast. Go fast. No.
Okay. Okay.
Simple issue. Huh? You call. Some technical problem I am trying.
Okay, ma'am. Okay, no issues, ma'am.
By that time, you can ask questions on that also. She is calling that.
Okay, madam. Can you hear me?
Yes, yes.
Okay. One question regarding is so we have only one biomedical waste treatment center at Palakkad, Ayona. It's run by Indian Medical Association, known as Image. Other than this one, are there any other chance of any other location Kerala to, because we are transporting all the biomedical waste all the way from Thiruvananthapuram to Palakkad, the north to south central portion, south to central portion. So we have one. Government of Kerala tried one location at Eringamala in Trivandrum due to some agitation. Actually, that dropped that idea.
Yes, yes.
You have any? Your board has any plan to have one in the immediate future in any part of Kerala?
Yes, yes. We are planning. We are not planning, but we are enforcing that because Image, they have proposed, they purchased land at Peringamala and where they conducted public hearing also. But due to the public protest, they in the environmental clearance is not issued so far. So another project, KEIL means the common treatment, hazardous treatment facility is also already there. In that already existing hazardous waste, there is no our own starting with another facility. So and they also obtained the environmental clearance also. So they have already started erecting facility there. It is almost completed. It will be completed in the next year itself. Image has their another second proposal. They got land at Brahmapuram. The corporation, they handed over to them, but they have the hurdle is that they have to obtain the EC. Unless the EC is not issued, they can proceed. The consent to establish, they already applied to the board, and it is on in the processing. And but one thing is that if number of facilities are coming, some competition, and healthy competition should be there. Otherwise, it will not work properly. All these functions. Anyway, the central area, south, north, we at least one or three facilities are needed for our state.
Okay, thank you, madam. Thank you. You can proceed with the e-waste. Okay. Now the slides are open. Okay.
Yes.
Okay, thank you.
Okay. Then e-waste management. Then you can see that electronic waste. Electronic waste is the byproduct of technical exploration of or the development activities of a country. It is an ever increasing waste. We cannot avoid the generation of e-waste, but the only solution is that we have to manage it in an environmentally sound manner. As all of us know that e-waste contain very valuable materials, including metal parts, then plastics is there, then gold, platinum, precious materials, ferrous, non-ferrous materials, then adverse effective embossing materials like lead, cadmium is also there. Then glass is there. So the resource recovery is the major concept, is the main principle or concept in the management of e-waste. Never we can avoid the generation of e-waste. It is because as part of our development, see, studies are showing that about 1% increase of GDP or technology development, about 2 to 3% of waste is generated. Studies are also there that OECD organization, they study that the delinking of this waste generation and development. Likewise, different studies are there. Still, the waste is increasing with the GDP increasing. So the e-waste it contain. How we can most e-waste are being stored at. We can see that in many households e-waste are being stored and they do not know what to do, how to dispose and all that. And in that also some precious materials are there, gold, silver, okay, copper, etc. Then unorganized sector, some unemployed children, including children, they will collect it, and for their daily earnings they are crude dismantling is practicing without knowing the adverse effects on their health and all. So I think about around 25,000 above workers, including children, are working in this field. This is the main issue regarding the e-waste in our country. And likewise in Kerala, it is very high compared to other states. Because of that, our Kerala government in 2014, they issued a notification or order to manage this e-waste rule. Then the next side, these are the main sources of e-waste. That is home, hospitals, government, private sector, restaurants, industries. These are all, we know that. We see television, this item is there. So then what is e-waste? Computer, monitor, everything is there. Sources of e-waste, major IT industries are there, individual, small business organization, households, large business, everything. Basically, basically anything with a main plug or battery, it can. Then these are WEEE. This waste electrical and electronic equipment. This is the product category from where we are getting. These are self-explanatory. Then status in India, the major facing is that post-consumer or insufficient volume. Is that if in India, in Kerala, we don't have dismantling units. In India, in some states that I will show in your coming slides. But the thing is that if the gold recovery or platinum recovery, we have to set up a recycling or dismantling unit. We should get the lump sum of that quantity we should get. Otherwise, we can't run that planned in profitable manner. So the insufficient volume of that quantity we have to import sometimes from the outer countries also. And you know that due to this resource recovery is the major concept, as I told earlier, in the e-waste management, so that their provision is also there that waste can be imported or exported, because this precious materials resource recovery is important. To extract precious materials from the mineral itself is very high cost intensive. So to recycle, recover from the already occupied products is it can be converted, take back the product and it can be converted into the production cycle. It is the resource recovery is the major thing in the e-waste management. And the last, after recovery of all valuable products or recoverable products only, we may go for the disposal. The last option, last option is incineration and landfill. But incineration, we know that incineration is not encourages, but fuel value recovery, fuel value you have to recover from waste to energy plants like that. Landfill is the last resort. Everything collected and ultimate, in a balance quantity only we can go for landfill. CPCB guideline for e-waste management, the e-waste management first rule only came into effect in 2011. So but in 2007, this e-waste electronic items were included in the hazardous waste rule only. Then later the quantity is largely increased. Then a separate rule is also notified, that is in 11, and now the superseding that rule, CPCB issued the guideline 2016. And in that 2016 rule, the different categories of e-waste, that is 20 items are there, no? And some special code is there coming in the next slides. Consumer electrical items, 5 items. Then EPR authorization with approved plan. These categories of AAA is 20 items, consumer electrical items is 5 items. Then the mandatory provision is that EPR authorization with approved plan. EPR means nothing but extended producer responsibility. That means the producer have the responsibility to take back the system from the product once its useful life is ended. They have the responsibility to take back or buy back that system and channelize to the authorized recyclers or dismantlers, etc. By selling the product only, their responsibility is not right. There should be at the end, throughout the end, up to the end of the life, they have the responsibility. And this EPR authorization is issuing by CPCB guideline. These producers have to submit application along with the approved EPR plan, that target for collection, then how much they will collect. That period 17, 18, 10%, and like this quantity to be collected. Up to 2023, 70% e-waste from the market should be take back. Then Kerala, I told government order 1/1/2014, and I came to know that the next order is being prepared by additional amendments and all that. According to this 2011 census, that is 32.6% of household have mobile and phone connectivity. National average is only 11.7%. And computer connectivity in Kerala, it is 20.4%, and national average is 18.7%. Then from this we can see that e-waste is of greatest concern in the solid waste stream in our state. And as for responsibility, in that Kerala order, responsibility is clearly specified in that order, that producers are responsible for EPR. Otherwise, LSGDs, they have to support for channelizing the product from the market to the corresponding recycler or reprocessing or dismantling unit. Then Pollution Control Department of Climate Change, KSPCB, Biodiversity Board, etc. They should conduct awareness programs. So you can consider our participation in this also a part of this awareness program. Then we can report to the central ministry also. We are making awareness regarding this e-waste. Then LSTD shall provide some regarding this e-waste. We can see that some products like laptop, etc., computer, etc., have precious valuable materials we can recover from that. Some products we have to pay cost of recycling to the recyclers. So two types of categories of waste are there. The waste collecting agencies, for some products they will pay money, and for some product the generator or we should pay for disposal. Adequate system and responsibility, LSTD shall have the models door-to-door collection, but in Kerala, door-to-door collection is also progressing. Mandatory sanction to IT firms and hospitals should be made strict mandatory. Then buyback, take-back system by producers shall be made mandatory. Then these are I told you earlier that 11 items are coded in the e-waste rule. These are the item-wise EEE code ITEW2. Similarly, these are the products: personal computer, computing, copy equipment, like that, telex, telephone, 21 items, refrigerator, washing machine, and fluorescent and other The last one, fluorescent and other mercury containing labs. These are very risky thing, and this should, for collecting this, we have to pay money to the waste collectors for affording the cost of recycling or dismantling. The e-waste rule is applicable to all these sectors, that is producers, consumers, collection center, dismantler, recycler, manufacturers, dealers, refurbishers, producer responsibility organizations. What is producer responsibility organization means? The producer they can directly take back the products from the market, or they can engage an organization, producer responsibility organization. They can engage them. They will collect it and they will collect on behalf of the producer. Then this is electrical, electronic equipments. It is applicable components, consumable parts and spares which make the product, CFL and other mercury containing labs. Exemptions used lead acid batteries, because for handling lead acid battery, separate rule is there. So that is not included in the electronic waste rule. Then some micro enterprises, as defined under MSME rule, some small assembling such units, they will not have to come under this EPR authorization and all that. But still, electronic parts are there. They should hand over to the local body arrangement. They will provide the arrangement. They should do that. Radioactive waste is also not coming under this one. Then authorization means the authorization authorities, pollution control board, and we will give the authorization to these persons, refurbishing, dismantle, recycling, all these units. Consent is granted to manufacturer, dismantler, refurbisher, and recyclers, because in such units, these water pollution, air pollution, everything is to be considered. Then bulk consumers are central government departments, state government departments, public sector undertaking, banks, educational institution, everything. The electronic waste they are generating, they should also have the responsibility clearly vested in this, specified in the rule. Partnership, public or private companies, these bulk consumer, international agencies, everything is. Then manufacturer means manufacturing the electric component, that original that manufacturer is the manufacturer department. The producers are the manufactured products are, they will make the products by their own brand or in the brand of the manufacturers. That is producer, that manufacturers, they can sell the product on their own with otherwise the brand ownership of the manufacturers. Then collection center means collection individually or joint collection center we can. These PRO agencies or major brand owners, they can set up separate collection centers, or they can either take back their own brand products from the market, or the rule is, discussion is going on that irrespective of the brand name, they have to take all products at least by the major brand owners. So because the small entrepreneurs they could not afford that much. That is why this major brand owners can arrange something. Some discussion is at government level is going on. And dealer means dealer. Sometimes dealer may be the producer, or dealer can also collect it and take back system. Then dismantler means organized, legal, not crude dismantling, organized dismantling. That is having provided all the control measures without affecting to the environment. This dismantlers, no dismantlers are there in Kerala. They by Clean Kerala company is proposing it, or one unit they are in the process. No recycler is also there. Then refurbisher is also coming under. Refurbishers are the repair shops. In in general, we usually see that repair shops, they can repair it. It can extend their life of, and they can return to the owner. Sometimes they will resell that product from the market. They repair it and resell. It should be made it mandatory. Otherwise, crude refurbishing will be. This is one major problem all over India. This is extended producer responsibility that I explained. EPR authorization, the producers have to get it from Central Pollution Control Board, and along with the submission of application, they should provide the plan also. EPR plan, how much product will be, how they will channelize the product from the general source market to the recycler. Collection directly through or through authorized agency. However, the target should be monitored by State Pollution Control Board. They can collection through either dealer, collection center, PROs, through buyback arrangement, exchanges, in deposit refund system is also there. Once a product is consumed by a public, they will deposit some money in that producer. And once this at the end of the life of this product, they can this amount will be there for fixed interest. We will attract, we can avail interest from them. Then once this product after use, we will return, then they will give back the money to the consumer. That is deposit refund system. It can also be practiced. Then historical e-waste. Some schedule is there that within this period we have to collect the e-waste. And after the rule of 2016, before that period, some products are there, electronic waste, that will come under historical e-waste. It should be collected by the local body. Orphan products should have no branded or assembled electrical items. Then local body should arrange. These are all applicable to the manufacturer, etc. Then channelization of this fluorescent and other mercury contained lamps. Here recyclers are not there, so safely this should be handed over to the collecting agency, and they will hand over to the common treatment facility here at KEIL. There treat, immobilize the mercury and reduce the polymer waste, and it is disposed, produced. Then these are all dealers and all. Some figures are there, no? That I will show you. And this is important procedure for storage of e-waste. The rule specifies that e-waste cannot be stored for beyond 180 days, and not can be up to 365 days if some alternative methods is not there. Otherwise, this should be handed over to this. Due to this pandemic situation, we could not follow this time limit, and the stored waste are stored there, and it is waiting for tendering and all that. Then duties of SPCB is inventorization of this e-waste, and we are on the process of that inventorization. Once it is inventorized, we can have an idea how much is, because this e-waste quantifying it is a complex process because of the fluctuation that all products are coming from states and from the states to outside. So the quantifying or the methodology somewhat complex. Anyway, the inventorization we outsource to NIST. They are doing that. Now in our state, no. This is generators to pay. And this is what I will have to say is, these products, 14 products you can see in the slides, that CFL lamp, tube lights, floppies, etc. For these products, if the collecting agency, they have to pay some money to the recycler or the disposing agency. So they will, they are authorized by the government itself to collect money from the generators. And some 40 rupees, some now it is I think 45 rupees per kg, something like that. Then this is Clean Kerala Company is the authorized Kerala government agency for the collection of e-waste in our state, and some agencies are also there, eco solutions like that, but these are the authorized one. And these products 44 products. You can see CPU, LCD, LED, CRT, laptop. In these products, precious materials are there. We can resource recovery. So for this, they will pay the money. 10 rupees, something like that. They will pay the money and will recover that. The previous slide, we have to pay the money. These are the authorized collection centers. Now, the list is not complete because some other units are also there, but their consent is not renewed, so I didn't include it in this list. These are the collection centers. In Kerala company, they have collection center. Trivandrum and Wayanad Steel Corporation, then all these things. This is Ernakulam based collection units, e-waste collection centers. Then list of authorized e-waste dismantler declared. The name I not included in that. We can see that in each state, Andhra Pradesh, Chhattisgarh, in every district, Haryana, 28 dismantling units are there. Jammu Kashmir one like that. In Kerala, a Clean Kerala company, they tendered the EOI expression of interest. They invoked. Tendering is going on. So the outside foreign collaboration is needed for this, for setting up of this dismantling unit because of the complexity, sophisticated technology and all that. This is one slide I got it from a training regarding e-waste. I got it from there just to show the things. This is one printed circuit processing unit. There, this is crude dismantling, not the correct one. Crude dismantling. Here, see the printed circuit board. Everything acid leaching is conducted, and the acid is leaching. This will enter into the ecosystem. This also I got it from that training. One Tamil Nadu based e-waste recycling company. They 1,500 tons per annum they are handling with the permission of the Pollution Control Board. The CPR responsibility is the permitted activity of by the CPCB because of, I told earlier, that resource recovery. Then these are some of producers' name input. This slide is also from there. SRS, industrial post-consumer production rejects, parts recovery, recycling process, refurbishment and product recovery. Then the major valuable products, recoverable products are glass, plastics, metal concentrates, hazardous waste. Then the last resort, incineration or landfill. After refurbishment, we can use it as a product, or we can take back to the owner. This is not necessary. There, gold extraction. This is informal sector, unauthorized sector. This gold extraction is going on, and now a guideline is published by CPCB. They are in the process of that. This process, some pollution control measures is gold extraction process is needed. That is progressing there. And producers granted EPR authorization as per rule 2016 is all over India in all states 1,606. In Kerala, about 20 EPR authorized collection producers are there. Thank you. Hello.
Yeah, thank you so much, ma'am, for this wonderful session. It was excellent. There is one question. I think you have already answered it, but then I will just read the question. It is from Manikandan. How could we dispose household tube light? Still, common people dispose it in common places. So I think you have answered that.
Yes, yes. See, now households are storing that, and they don't know what to do, and they should collect it. And some local body is having the responsibility that they should collect it. Door-to-door collection should be there. If door-to-door collection is not there, some in Trivandrum Corporation, I could see that some calendar is there. In this day, Wednesday or Thursday, they will collect it, CFL lamp or tube lights. In this day, they will collect some product and they will show the calendar to all households. They can deposit there on that day. Otherwise, the local body should collect it. And these tubes, they should have transported safely or handed over to the Clean Kerala company, and they will transport it to the Common Hazardous Treatment Waste Facility KEL at Ernakulam. They will recover with pollution control measures. They will some vacuum breaking unit is there. The mercury vapors if there from arrangement is there. It is removed and it is safely landfilled there.
Okay, ma'am. Yes, ma'am. So the session is open for discussion. If there are any further questions, then please feel free to ask.
Okay. So if I can, I will. Yes. Continue, ma'am.
Yeah, so I was telling the participants that the session is open for discussion. So if there are any questions, then they can ask. Come forward.
Yes.
Madam, I have one additional point regarding this one. PP kit in the case of COVID-19 pandemic. I came across one video or something like that. One fellow from Kerala, she actually treated this PP kit. Then it converted it to some bed. It's actually metta, bed.
Oh,
ഇങ്ങനെയുള്ള ലൈങ് ബെഡ് ആയിട്ട് നമ്മുടെ കോട്ട പറയില്ലേ, കഞ്ഞിമെത്ത പോലെയുള്ള അതുപോലെ അതിന് പകരമായിട്ട് ഇതിനെ ഇങ്ങനെ അതിന്റെ ഫൈബേഴ്സ് ഇങ്ങനെ സെപ്പറേറ്റ് ചെയ്തിട്ട് ഇങ്ങനെ ക്ലോസ്ലി പാക്ഡ് ആക്കി ഏതോ സം ടെക്നിക്, വീവിംഗ് ടെക്നിക് ഉപയോഗിച്ചിട്ട് അതിനെ മെത്തയാക്കി ഉപയോഗിച്ചിട്ട് അതിങ്ങനെ ഒത്തിരി ഹൺഡ്രഡ്സ് ഓഫ് അങ്ങനെയുള്ള ഉണ്ടാക്കിയതായിട്ട് അതിനെ വേസ്റ്റ് മാനേജ്മെന്റ് ഒരു പുതിയൊരു ടെക്നിക്കായിട്ട് ഞാനിങ്ങനെ യൂട്യൂബിലാണോ ഇതിലോ ഞാനിങ്ങനെ കാണാനിടയായി. സോ ഹോസ്പിറ്റൽസ് ഉപയോഗിക്കുന്നതാണ്, എത്രയോ ആയിരക്കണക്കിന് യൂണിറ്റ് ആണ് അവർ കൺവേർട്ട് ചെയ്ത് ഇങ്ങനെ എടുത്തത്. സോ ഇങ്ങനെയുള്ള ഇന്നോവേഷൻസ് ഒക്കെ വളരെ നല്ലതായിരിക്കും. ഇഫ് ലേഡിയാണ്, അവരിങ്ങനെ കുറച്ചായിട്ട് ഇങ്ങനെ ആലോചിച്ച് എന്ത് ചെയ്യാൻ പറ്റുന്നുള്ള ആലോചിച്ച് കണ്ടുപിടിച്ചാണ്. ആഫ്റ്റർ 1 month research, she found that it can be converted to some useful product which can be reused in Kerala. So there was a question here, ഇങ്ങനെയുള്ള വേസ്റ്റ് മാനേജ്മെന്റ് എങ്ങനെ ചെയ്യാൻ പറ്റുന്നതിനെ പറ്റി ഡ്യൂറിംഗ് ദ കോവിഡ് പാൻഡമിക്. യൂസ്ഫുൾ പ്രോഡക്റ്റ് ആയിട്ട് നമുക്ക് റീസൈക്കിൾ അല്ലെ റീയൂസ് ചെയ്യാൻ പറ്റും. വി ക്യാൻ യൂസ് ഇറ്റ്.
ഒറ്റ കാര്യം സേഫ്റ്റി. അപ്പൊ ആസ് പെർ റിക്വയർമെന്റ് നമ്മുടെ റൂൾ അനുസരിച്ചുള്ള സേഫ്റ്റി മെഷേഴ്സ് എടുക്കണം എന്ന് മാത്രം. പിന്നെ
അങ്ങനെ ഇതിന് ശേഷം ചെയ്തെന്ന് അവർ എഴുതിയിരിക്കുന്നത്. എങ്ങനെയുള്ള സേഫ്റ്റി മെഷേഴ്സ് എനിക്കറിയില്ല. എനിക്കൊന്ന ഈ സാനിറ്റൈസർ ചെയ്തൊക്കെ ആയിരിക്കും, സാനിറ്റൈസർ ചെയ്തിട്ടായിരിക്കും എടുത്തിരിക്കുന്നത്.
എനി ന്യൂ ഇന്നോവേറ്റീവ് ടെക്നോളജി ഫോർമുലേറ്റ് ചെയ്താൽ CPCBയുടെ പെർമിഷൻ വേണം എന്നൊരു ക്ലോസ് ഉണ്ട്, സെൻട്രൽ പെർമിഷൻ കൺട്രോൾ ബോർഡിന്റെ. സോ ഇറ്റ് ഈസ് അഡ്വൈസ്ഡ് to follow that guideline also.
So based on your 2 hours talk, what I understand is that CPCB has all the required guidelines, what to do, what are the do's and don'ts. But the implementation part, when it comes to the implementation part in India, it's become a really tough job. All the rules are there. Like other developed countries, we have for every activity we have rules. What are the do's and don'ts? But when we come to the implementation, we have a lot of loopholes. CPCB cannot enforce the rules to the common people, and actually that creating a lot of problem. So using political power, all these things, people are actually violating the rules and not implementing the rules. They are escaping from the penalty, all these things. Okay, what is your opinion regarding the implementation of the rules? To what extent CPCB can or the Kerala State Pollution Control Board can implement the rules in our state?
Yes. What sir said is correct. We have a handful of rules, about 33 numbers are there. and every year separate rule exclusively for different types of waste is also coming. But the implementation part, I think the major is some common facility. If we are proposing some common facility, their public protest is there. We have to take into confidence that public. Otherwise, these common facilities could not be implemented. Some role model plans should be there. Then we can showcase this will be this like this, and we can manage and something. Then another one. In the statutory authorities also, staff shortage is the major problem we are facing. Then the monitoring part, we have to monitor everything. Some routine monitoring period is there, but we can't complete that within that time frame and all.
Yeah, what you say, it is correct, madam. In the case of, we need to have some role model plans. It may be a small plan. For one example is in the case of slaughter waste, Trivandrum, we don't have the plan. All the slaughter waste from Trivandrum is going from Trivandrum to Ernakulam. Why don't we have a slaughter waste management, slaughter waste treatment plant, not only in Trivandrum, maybe in the outskirts of Trivandrum, suburban area, maybe one or two panchayat can jointly, they can start one unit. For example, it can be unloaded to feed, like the pellets. You can convert this slaughter waste into pellets. So I think in Kozhikode we have one plant there, maybe a private agency.
Yes.
With the help of Pollution Control Board, I already contacted them. They told me they will come to Trivandrum. We can have a discussion for starting a model plant, maybe the outskirts of Trivandrum city, maybe rural area. Then not much issue will be there. So we need to have some small role model plans so that we can showcase the public. This can be done in a much efficient way without creating problem to the environment.
Yes,
Okay,
in Kozhikode and Malappuram area, number of rendering plants are coming.
Yeah.
Rendering plants. What you said is correct. It is converting into food material, cattle, animal feed we can use. But if a number of units are concentrated in one area, it will lead to unhealthy competition and all that. That's one problem. Then the public protest is another one. If the land is available, it is well and good. In Trivandrum, the major problem is land availability. In Kozhikode and Malappuram, availability of land is much easier there. So their number of rendering plants are coming. Here also in our slaughterhouse owned by corporation, their proposal, I think it is Sheila Madam can answer. It is under progressing. I think rendering plant. Yes.
Yeah, that's very important. Each district, maybe the outskirts. If you have some land, suitable land without affecting the water body, maybe a midland region. Suppose you have a suitable land with very little population that nearby region, then if some agency along with the PCB, if we can ask the universities, even colleges, they can also associate with the PCB. There will be a teamwork. We can also take into consideration the conference of the local people there, the panchayat there. So a group of even non-governmental or organizations, eco club. So all these things, if we move together as a team, then a teamwork will be very much needed to take the conference of the local people. And this monitoring is very much needed. So in the university, colleges, in the various clubs, they can monitor the activities there, so that in the long run, we can have that type of model plans. So based on that, when we can have different plans in various parts of Kerala, and ultimately we can solve the issues.
Yes. In my introductory speech itself, I told you that research organization has a very important role in our environmental policy formulation itself. So innovative technologies you should develop, and in cooperation with other regulatory bodies, it is very good. We can have a good result we can get.
Okay, thank you, madam, for the inspiring lecture. Now I invite Dr. Ayona to wind up this session. Okay,
thank you. Yeah, thank you, sir. So we have had a very informative and interesting session on biomedical waste management, e-waste, as well as the rules related to it. Premalatha ma'am started with the famous quote of Mahatma Gandhi: "Earth has enough to every man's need, but not to anybody's greed." In the initial part of the lecture, she gave a detailed view of timeline of environmental policies starting from Earth Summit 1992 to National Environmental Policy 2006, which encompasses a polluter pays principle and precautionary principle. Then ma'am gave an overview of the health system and the need of personnel in the health system to be made up to date regarding the various biomedical rules. She touched upon and compared the annual reports of CPCB 2018, 17, and 2016, which showed that an increase in quantity of biomedical waste that is generated over years. She gave a very detailed account of various types of waste generated from healthcare unit, which was shown specifying the relative quantities and classification as well as properties. It elicited our concern when we found that some of the healthcare personnel were not aware of the biomedical rules. Premalatha ma'am talked on how we can manage various waste from healthcare systems and give a detailed account on biomedical waste rules. Talked about color-coded bins used for biomedical waste management and mode of disposal of various waste, and about barcoding system, technique of waste reduction as well as discarding. She gave an idea about the common facility available in Kerala for biomedical waste management and about the duties of occupiers. Srimati Premalatha also kept us updated regarding the Kerala model of biomedical waste management during COVID pandemic. Ma'am talked about the apps developed to track the waste generated from COVID control centers. She also showed how compensations were calculated, if any, in case of laxity. Then, as a second part of her session, she gave an account of e-waste, the sources, then resources that can be recovered from e-waste, which can be harmful to collectors, the status of management methods available in India, the CPCB guidelines for e-waste management, responsibility as per orders, the sectors which come under e-waste rules, the sectors which does not come under e-waste rules, etc. Then various terms concerning which comes under e-waste management, and also the procedure for storage of e-waste. She elaborated on the duties of State Pollution Control Board in matters concerned with e-waste and listed the collection centers available. So the session was excellent and was very informative, interesting, and with exhaustive knowledge. We could get a first-hand information from a very relevant person. I would like to congratulate you, my dear ma'am, and thank you on behalf of the organizing committee as well as all the participants assembled here. Thank you so much.
Thank you, ma'am.
Thank you, Premalatha madam, on behalf of the organizing committee, on behalf of University of Kerala for the more than 2 hours very inspiring session. We know that PCB team is the right team to talk all these aspects, because you know everything regarding the theoretical aspects as well as from the government side, what are the things to be done and what is the status, all these things. Okay, thank you, ma'am. Once again, I thank you. Also, I take this opportunity to thank Dr. Ayona and Jayadev. She is actually chaired this session in a very well manner. She is an associate professor, Department of Environmental Science, Soil Science College at Trivandrum. Thank you, Dr. Ayona, for efficiently chairing this session. I also thank our participants. We have more than 50 participants in this session. Most of them actively participated by sharing the questions, posting the questions in the chat box, and also interacting. I think all the informations actually shared by Premalatha madam, very useful to the students as well as the teachers to update their information regarding the biomedical waste. In fact, I am also a subject expert in Pollution Control Board regarding the biomedical waste management, particularly for making a formula from Kerala State. Yeah, regarding the co-compensation part.
Yes.
How much damage caused to the environment by means of this dumping of biomedical waste. So actually the process is going on. We have not yet finalized the formula. Anyway, it's very useful. I thank you all the participants. We are winding up today's session. Tomorrow at 10:30 we will have the third day. We have a very interesting session, hazardous waste management by Shri Pradeep Kumar, another very eminent resource person from Kerala State Pollution Control Board. I welcome each one of you tomorrow's program also. We will start at sharp 10:30. And in the afternoon session, we have another topic on industrial solid waste management with the special reference to biocomposting by our own faculty member, our head, Dr. Thiruvananthapuram. I welcome each one to that program also. Once again, thanking you all. Thank you.
Thank you, dear participants, for listening me. Thank you.
Okay. Thank you, madam. Thank you very much.
Thank you, ma'am. Thank you.
Okay.